Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Mode of spread of renal cell carcinoma. One of the most characteristic feature or most important feature is invasion into the renal vein. So renal cell carcinoma, it can invade into the renal vein, and if it invades into the renal vein, then the tumor emboli will pass through the renal vein, and from there it reaches the inferior vena cava will drain into the heart. So it goes into the right side of the heart, and from the right side of the heart, the uh, through the pulmonary artery, it goes to the lungs. So you will see secondaries in the lungs also. So from the lungs again, the blood and the oxygenated blood will go into the right side of the heart. From the right side of the heart, it goes to the aorta, and from the aorta, uh, tumor cells can go into the brain, or they can go into the liver also. So overall, the most important spread is to the invasion into the renal vein. And this renal vein, whenever there is invasion into the renal vein, this leads to the continuous cord of tumor is seen in the inferior vena cava. From there, the tumor reaches into the right heart, and from the right heart, it goes through the hematogenous route. Okay, then the most common route of spread thus is the hematogenous route of spread is most important. Then from the hematogenous route, the distant metastases are seen. So, most common site of distant metastasis is first lungs, and from the lungs also the tumor will go into the bone, liver, and finally to the brain. Even lymphatic spread can be seen beyond the renal capsule. So lymphatic spread is also common, but the most important is through the renal vein. From the renal vein, it goes to inferior vena cava, and from there to the right side of the heart.
thank you and thank you for watching.